Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. This program focuses on different healthcare services and programs that we offer here at KRMC that will be of interest to you and your family. I've got a great guest on my show today, so I hope you'll stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Tina Tharp with Respiratory Therapy. Hi, Tina. Thanks for being on the show today.
Thank you. Thanks for having me.
Well, it's great, and we're always learning new things. I tell people that all the time. Every time I do this show, I learn something new. So I know my guests do too. So respiratory therapy, it's all about breathing, I assume, right?
Yes, respiratory therapy is all about your breathing system.
Okay.
Your lungs, how they work. And we assist people that maybe they have a little bit of trouble and their lungs don't work quite as well as they used to.
Okay. Now, how did you get into that?
Actually, it was a little bit of fate. I had requested some flyers from a community college on some different things because I like pretty rocks. And they actually sent me a flyer on respiratory therapy in my package of flyers on Pretty Rocks.
Oh my goodness.
So I took that as a sign, and I started school 3 months later.
Okay.
Got in on someone else flunking out of chemistry, and that was 18 years ago.
Where was school?
Blackhawk College in Moline, Illinois.
Oh, okay. So you've been in the Midwest. Is that where you grew up?
I grew up in Iowa, yes, ma'am.
Okay. Watch the corn grow. I'm
Watch
from
the
Minnesota, so
yes,
I can
did.
joke about
and
that.
The Hawkeyes play football.
Very good. So you went to school in Illinois, and you said that was 18 years ago? You don't look that old.
Graduated 18 years ago, yes,
My
ma'am.
goodness. Wow, okay.
Well, you're sweet.
I wouldn't have guessed that. Shows I'm getting older, too, though. So anyway, so you went to school in the Midwest, and then you started practicing?
There weren't really any jobs back there. The area was saturated because there were so many schools. And Peter Jennings said on Nightline, he said, talked about managed care in Arizona, and he said, as a healthcare practitioner, if you can make it in Arizona and manage care, you can make it anywhere.
Oh, wow.
And I took that as a challenge, and 6 months later I moved to Phoenix.
Oh my goodness.
And I was there several
great.
years, and then to Texas for a little while, and now I'm back.
Awesome. So you like the warmer weather? Although we're cooler.
No humidity.
Yeah, we're a lot better than Phoenix or Texas. Yeah, that no humidity, that's a big seller.
That's huge.
Yes.
No hurricanes.
That's right.
Huge.
Yeah, I've got a brother in Houston. We go to visit, and I'm like, oh, how do you do this?
Miserable.
I know. Okay, so you came to KRMC how long ago?
14 months ago. I was recruited and came.
Very good. And you're doing respiratory therapy.
Respiratory therapy, but I don't work on the floor with your average patient who's sick in the hospital. I help people outside of the hospital with breathing tests, and we've just started a program to do 24-hour heart monitoring.
Oh.
And
how do you do that?
It's a little machine that actually is the size of a pager.
Okay.
And they come in, we put all the leads on them, and they wear it home.
Okay.
And they wear it and just do their normal activities other than showering.
Okay.
And write down their symptoms, and they come back in, we take it off, and we download everything, and it goes to one of our cardiologists to be read so that it can maybe find symptoms you wouldn't find in a 10-second EKG.
Interesting. I like that. That makes a lot more sense. And you can do it in the comfort of your, just your day-to-day normal.
Well, and when you're laying on the table and you're getting your EKG, you're not doing your normal activities, so maybe your heart's not doing what you're complaining about, or you're saying, hey doc, this is what's going on.
Yeah.
And so if you take the monitor home and you do the normal stuff you do, then it does what it wants to do.
Yeah.
And then
you're
we can
see
catch
those
it.
symptoms.
Yeah.
Makes sense. So how does a person get a referral from their primary care physician? Is that how they
only need to see their primary care physician because they are read by a cardiologist. They can get their order from their primary doctor, come straight to us, and we'll take care of the rest of it.
Okay. So now, is there a phone number someone could call if they have questions? Do you have...
it is 8555.
Okay, 8555.
Yes,
That's a good one. So now you mentioned respiratory therapy and that it's kind of a new, this outpatient side is new. What else are you doing besides the...
We do a lot of the breathing tests, the pulmonary function tests, which doctors will order if someone's lungs, they suspect maybe there's something going on. And with chronic obstructive pulmonary disease, a lot of times they'll order follow-ups every year to monitor the disease.
Right.
With asthma, they do the same thing. They'll order follow-ups. And we also do a drug challenge test where if they suspect someone has asthma, we can actually give them medication in a safe environment to trigger those symptoms to judge the severity of their asthma.
interesting.
So and they come and they sit in a little box and they alter their breathing pattern a little bit, and then that gives us an idea of the physics of their lungs and how their lungs are actually working inside with regard to how the air flows in and out, how the oxygen moves, and just what volumes are in there on a normal basis.
Okay, and that's obviously important. I mean, our lungs are, between our heart and our lungs, those are kind of the two most important things we need, right?
Well, if you can't breathe, you can't do anything else.
Yeah.
So if we can improve the quality of somebody's breathing by doing a test and getting them on the right road to their care and getting the right diagnosis so they get the right medications and the right therapies, then the quality of their living is going to go up.
Awesome.
So
that makes a huge difference.
A huge difference, yes.
So if someone does have early asthma or the COPD and things like that, there are medications that can help them.
There are.
It's not a, well, that's it, sentence kind of thing.
No, not at all. For asthma, especially, there's a lot of reversible airway constriction. That's the marker of asthma. That means that when I give you a medication, I can take that wheeze away.
Oh, wow.
So we can look at how often they need medication. There's actually protocols now. There's a global initiative against asthma to help control it better, because we found that if people are having symptoms, damage is being caused. So we want them, yes.
Okay.
And we want them to not have symptoms. So there's actually guidelines that your physician will follow now and give you medicine to prevent those things from happening, so that you don't have to feel like that.
Okay.
We don't want anybody to wheeze and be short of breath.
Right.
We want to prevent that.
Right. And that's, I can only imagine how scary that is to
It
feel
is.
like you
I
can't
have
breathe.
asthma myself, so it's a very frightening feeling. And just imagine breathing through a straw.
Right.
And that's all you get to breathe through.
Wow.
And that's the size of a breath you get to take, and that's how fast you can take it. And it's a terrible feeling. So
Right.
we don't want people to feel that way.
No. Okay. And you're saying that not only are you feeling scary and having all that, but then it's causing damage at the same time.
Right.
So.
Right. When you're having those symptoms, you're having more damage done that's going to lead to more disease later.
Okay. So
it's and so when
get
your doctor
that out of there.
right. So when your doctor does prescribe those medications, you may not feel something from them, but that's okay, because they're preventative medicines. Just like you don't feel an effect from your cholesterol medication,
Right.
you're not going to necessarily feel an effect from your preventative medications for asthma. And the same
Other
thing with
than you're not having those
right, you're
symptoms.
reducing your symptoms.
Okay.
And the same thing with chronic obstructive pulmonary disease, COPD. We
Right.
want to prevent their symptoms so
Okay.
that they're having
Making
a higher
them from
quality of
getting
life.
worse.
Yes.
Okay.
And slow the progression of the disease.
Well, and I think what's cool now, what we were talking about here, is it's outpatient versus inpatient. Because I think in the past, pretty much you had to be in the hospital, right, to have a lot of those treatments and
Tests and stuff
testing
run.
done.
Yes, and
So
now
then-
it's we're open 4 days a week. Every morning we do PFTs in the morning.
Okay.
And that also leaves time. We do other services as well. The Holter monitoring we can do 5 days a week.
Okay, that's what they call that
The
take-home
little
monitor,
heart,
is a Holter monitor.
the heart
Okay.
test, yeah.
Okay.
We also do the arterial blood gases for the doctor instead of the lab. They come to us. Usually we'll draw from their wrist.
Okay.
We'll take the arterial blood their body hasn't used yet, and we can look at what their oxygen is before the tissue uses it, what their carbon dioxide is before the tissue uses it, and their pH. And it tells us a little bit how their lungs are working in accordance with your kidneys, even, because we see your bicarb and different things that happen with your kidneys, and we can say, you know what, you've got this going on respiratory-wise, and you've got this going on metabolic-wise, and there's things that the doctor can do to adjust and fix that. And they'll send people in for that also, to prove that they need oxygen for their insurance companies.
Okay, because you have those test results, and then the insurance. Okay,
Yeah,
so
they
you
need a certain level in order to qualify for
insurance
payment.
coverage.
Yeah.
Sure. And that's, I know, again, scary, I guess, to have to use oxygen all the time, but how important it is.
And especially with COPD, it slows down the progression of the disease.
Okay.
So if someone has COPD and their doctor puts them on the oxygen, there's actually a reason for that, and there's studies out there to back that up, that it will slow the disease down and they'll have a better quality of life.
So it's really important they follow that.
It is. And there's more, there's far less stigma than there used to be with wearing oxygen. But for people that still are self-conscious, there's also things that we can do. Your home care company can order the glasses now that have the little, they fit on your face.
Glasses,
and
like seeing glasses?
yeah,
Or
and the
reading?
little oxygen pieces come down around your nose and into
Really?
your nose. You know, and you may have to pay a little extra for those, but that's something that your home care company can
So where does the oxygen
supply.
come in? Behind the ears?
It's
Really?
just a little string that comes up, and it comes up one side of the glasses and then it goes down the nose.
Oh my, that's
Yes.
pretty cool.
To kind of hide it and camouflage it for people who are more.
You know, I got to tell you, it's probably us baby boomers that have pushed that stuff, you know, because
But that's great.
we're all so afraid of aging, you know, looking like we're getting older. It's like I remember when I had to get glasses with when my mother had them, they were trifocals, I think. And so when I got them, they were called progressive lenses. I'm like, oh my, what we won't do to avoid those.
But that's okay, because then you can have fun with it a little bit.
Right, yeah.
You know, and we may get to those point someday where you've just got attitude glasses, you know, and maybe you don't need glasses, but you've got a nice pink pair you can wear with your oxygen.
That's true. The frames nowadays are much better than they were when I was a kid.
You can get one for every outfit.
There you go. Well, that's pretty cool. I have to admit, I'm going to be watching more now, because I don't think I've ever noticed, which shows how much or how well it's kind of hidden.
Even a normal cannula, a lot of times you can't see on people's faces because they're clear.
Right.
You know, you see the tank following them, but you know, you can get a cool backpack and put it in there.
Yeah.
Or, you know, they've got some neat roller bags now you can use.
Sure.
So.
Or you have the one almost like a side purse that you can carry.
And seriously, people in their 20s are going to oxygen bars.
Oh, well, that's true.
You know,
I hadn't thought of it
they're going to
that way.
oxygen bars. They're getting a scent in it. They're sitting there. They're paying money to get what, you know, people just get at home for regular
now I gotta
doctor
ask
visits.
you, okay, since you brought it up, the oxygen bar, what does that do for you?
It really doesn't do anything for you.
No?
No, it's somebody who doesn't need oxygen sitting there for the short term, getting their oxygen boosted. So it's like they sat there and hyperventilated for a few minutes. They got a little oxygen, they got a little lightheaded from it, and they went, ooh, I got something I paid money for, yay! And it really didn't do anything for them.
Well, and I know that in bigger communities I've seen where they have the oxygen bars and they have flavored oxygen. I mean, like, what, really?
Yeah, they do on Fremont Street in Vegas. And
so, I mean, it's like, so you feel like you're breathing in chocolate or something?
Yeah. And you know, they get lightheaded, but they get lightheaded because of the extra oxygen. And
okay, so it's not harmful.
It can be to someone who doesn't, who has COPD and who retains carbon dioxide. Because we breathe for two reasons. We breathe to get oxygen, and we breathe to get rid of carbon dioxide. So for someone who retains carbon dioxide, your only reason left to breathe is to get oxygen. And if we increase that oxygen too much, which is why some people's doctors will tell them, don't go above 3 liters.
Okay.
It's dangerous.
Okay.
Because they retain that carbon dioxide, and then they stop breathing.
Oh, not good.
And then they go into a respiratory arrest or a respiratory acidosis.
Well, we'll talk a little bit more about that. We need to take a quick break, and then remind me when we come back. We can talk more. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Tina Tharp. Thank you again for being on the show, Tina.
Thank you again.
And again, I tell people all the time, every time I do this show, I learn something new. And again, today, I've learned something new.
Well, fabulous.
And we were talking about the oxygen bars. And I think it is important for people to realize that there is such a thing as having too much
There
oxygen.
is such a thing as having too much oxygen. So when your doctor tells you, please only use 2 liters, please only use 3 liters, there's a reason behind that in your body's chemistry that they don't want you to do that.
Right.
So that can cause you to have to come to the hospital.
Okay, so we'll tell our guests, make sure you follow those doctor's directions.
Because it is a drug.
Oh, I suppose. I hadn't thought of it that way.
So
but
anytime you take a drug, you want to take what's recommended.
Right.
You don't want to take more than that.
Right.
You know, look what's happened with Tylenol.
Well, you know, I have to admit, being from the Midwest, as we talked about earlier in the show, I think that there's some kind of a mantra there that if a little bit's good, more is better.
Yes.
I use that for
Yes.
My mother was notorious for that.
A little bit of chili powder's good in the chili. Let's put more.
Yeah.
Yeah.
So that is important that people realize that those limits are set for a reason.
They're for a reason, because your body chemistry, if you've got a chronic lung disease, can change in between those doctor visits and those tests. And you don't want to find that out by waking up in the ICU with a breathing tube.
Yeah, not a good thing.
No. So we always want to, and if you're having problems and you feel like you need more oxygen, come see us.
Okay.
Go see your doctor. Get help. Don't try to answer that question yourself.
Right, by
there's
playing
help out
with your
here. Right. That's what we're here for.
Yourself. Okay, good. So another thing we mentioned that we were going to talk about here was the EEGs. Now, what does EEG stand for?
EEG is an electroencephalogram.
Okay.
And that is basically an electrical recording of your brain waves.
Okay, so we're going from lungs to brain.
To lungs to brain. And
Okay.
because we don't have a neurology outpatient department in the hospital, the respiratory department took it upon themselves to train with Mayo and to learn how to do this so that we could provide this service to the community.
Another part of KRMC's relationship with Mayo Clinic now. We're able to do that. That's very cool.
Yes.
So exactly what does that mean? What are we doing?
What I do is we take 24 electrodes and we place on someone's head, 2 on the chest.
Okay.
And then we'll monitor the person's brain waves for approximately 45 minutes. The national standard is 20. But because we use Mayo protocols, we do things just a little bit better.
Okay,
so
very good.
we monitor their brain waves for 45 minutes.
So you're just kind of laying on a table?
They're just mostly laying there. In the middle, I ask them some really silly questions, which they think are quite funny.
Oh.
But it's mostly to see how their brain reacts when they're thinking. We'll flash a little light in front of their eyes to see how their brain reacts. And if they don't have a lung disease, then we'll do some heavy breathing with them to see how it reacts also.
Okay.
The most uncomfortable part of it is that you got just a little bit of paste in your hair that we
go
will
home
wash most of it out before you go home. Yeah.
Okay.
We will not let you leave the
Looking
hospital.
like
yeah, looking like Phyllis Diller.
Okay.
We won't let it happen.
That's good. That's good. So then you do that for 45 minutes and it's sent.
We record that and then we upload it to a shared drive with Mayo. And once we contact the physicians, the epileptologists are what they're called. They specialize in seizure disorders and things like that, and they're the best at reading the EEG reports because there's several lines of brain waves that they're looking at.
Okay.
So they go on, they look at it, they do the interpretation. If they see something that's alarming to them, they will actually call the physician themselves and speak with them.
Okay.
Otherwise, they will dictate a report just like with any other test.
Okay. Now, what are the kind of symptoms or reasons that a person would need an EEG for?
Sometimes what will happen is people are blacking out, falling down.
Okay.
Their loved ones are noticing that they're going into a state where they're not really answering questions and they're just staring off.
Okay.
Okay. Sometimes it's the loved ones are noticing that they stop answering questions and speaking and they're shaking and their extremities are moving and they suspect that they may be having a seizure. Sometimes they'll order them for if they suspect they've had a TIA.
Okay, which is?
A transient ischemic attack. It's
like a mini stroke, right?
A mini stroke that happens in the brain, correct.
Okay.
And sometimes if there's just something that's not right with their cognitive abilities, their thinking, they'll order the EEG to see if there's any slowing in their brain waves. Okay. To diagnose and see if, something that medication can help or not.
Now, are those the type of symptoms, too, that might be a precursor, if you would, to like Alzheimer's, dementia, anything like that? Is that the things you're looking for? Is it more stroke type of?
It's more, usually what we do is more stroke and seizure related.
Okay. So that's, and again, someone would be seeing their primary care physician first and getting a referral.
Getting a referral to us, and then because it's read by an epileptologist, they don't need to see the neurologist to get the referral. They just need their primary care physician.
Okay, and then the Mayo Clinic would then send the results back to their primary care physician.
If there's an alarming result, they'll call them. Otherwise, I get the results and I'll send them off. Yes.
Okay. So how long does something that usually take?
It's usually about a 24-hour turnaround.
Well, that's pretty fast. Are we talking Rochester or Phoenix?
Phoenix.
Phoenix, okay.
Yes. And we've actually, it was really nice. We got to go and train with them.
Oh, cool.
And meet all of the doctors that we will be working with and meet all of their EEG staff that they have up there. Because they have their own department, they do so many. And they have an ambulatory unit that they will actually use glue, put the electrodes on your head, and you get a little
almost like the
pager-sized monitor. Yeah, and you walk around the unit being filmed. And
so you're not laying in that case, you're actually moving around just like with the Holter
So somebody
monitors.
that would have a seizure disorder and would need further diagnosis, there is a place for them to go that's nearby.
That's very good.
Yeah.
So this is new for KRMC.
This is new. We just started this back in June of last year. We had someone who would come in and do inpatients that just worked as needed for the hospital.
Okay.
So there was a little bit of a lag time in how we could provide the service.
Right.
And so we wanted to be able to provide a better service to the community and to be more of a help.
That's cool.
So we took this on so that we could do that.
Right. Well, I know Respiratory is doing a lot of cool new things. And so it's exciting to hear about that. Is there anything else that you're doing that I should know about here?
Let's see. In outpatient services, we don't do a whole lot more. We do the EKGs.
Okay.
So they can come in and get an EKG. It's pretty quick.
Is that done through central scheduling?
No, they can schedule right through the respiratory department.
Oh, okay. Because if
they don't have an appointment, as long as it's between 8 a.m. and 4 p.m. in the afternoon, or during the day, Monday through Friday, just show up with your EKG order.
Oh, really?
We'll get it done.
Well, that's good to know too, because I know I just had someone not too long ago ask me that they needed an EKG for a physical that they needed to have for insurance, and to be honest, I sent them to central scheduling because I thought that's where they needed to go, but hopefully they'll send them on to the right place then.
Yeah, they probably do.
That's good.
And the same thing with the blood gases. If they come from their doctor's office and they're like looking at that going, oh my gosh, he told me to go to the hospital, but he didn't tell me where to go.
Right.
Just come see us in respiratory and we'll take care of that.
Super.
No appointment needed.
Okay. Now you mentioned earlier you're talking about the little room. I think I've seen that little room that they go in to have the PFTs, and that's pulmonary function testing.
So lung function testing, yes.
Okay. And it kind of looks, it's almost like a clear closet.
It looks like, to me, I like to compare it to Doctor Who's phone booth.
Oh,
yeah. Because it's kind of adventurous.
Yes, yep, it is.
You know,
yeah.
But for most people it looks like a phone booth. It's just a little bit smaller. It's a little shorter. And I promise I only close the door for 60 seconds.
Well, and plus it's
clear
glass.
Clear. Yeah, it's plexiglass, so you can see out of it. But people still get a little nervous, you know,
yeah,
because
I suppose if you're
not in control of that door. It's
right.
nerve-wracking. But the tests that we do, we have to close the door. We only do it for 60 seconds.
Okay, okay, that's good to know. So you're enjoying your time in Kingman?
I love it here.
Good.
I lived in downtown Houston where it was so noisy.
Oh,
and the peace and quiet here is amazing. I love it.
We got cool rocks too. I assume.
I know we've got great rocks. Yeah, that was one of the reasons I missed it so much, was I couldn't see any rocks in Houston. It's all flat. Here, I walk out on my back porch at night, and there it is. There's the mountain.
Oh, very good. Yeah, there's lots of good hikes you can go on. Go up to the Wallapies. And
yeah, Fort Beale.
Yep, very good. So you've been out exploring.
I've been out exploring a little bit.
That's very good to know.
Have feet will travel.
Family here at all?
I don't have any family here. Just me and my 4 dogs.
Oh, 4 dogs.
Well, I bought a house for them.
Very good.
Yes.
So that's family. 4 dogs. That's
well, when you buy a house for them, it is.
Yes.
No one would rent me with 4, so I just bought them their own house.
There you go.
Yes.
That's too funny. I love it. And you've got a great team you're working with.
We have a fabulous team. We really do. I've worked at 13 hospitals over my 18 years because when I lived in Phoenix, it was feast or famine. In the winter, you worked like crazy, and in the summer, you were lucky to get any hours.
Is that the weather, or was it because
snowbirds?
Snowbirds.
Yes.
Okay.
So you always had 2 jobs in the winter because you wanted to work 6 days a week because you knew you were going to work in the summer.
Oh.
And that was fine. You know, you were tired anyway.
Yeah.
You just saved your money.
But then you went north to get out of hurricane season. Just kidding.
Terrible.
I know.
Terrible.
I know.
So, you know, there's more teamwork here than I've ever seen.
Oh, that's good.
There really is. We've got a really great department that just meshes really well, and
they work well, I know, with all the other departments, because when we get like patient satisfaction reports, and even from the ER, and they talk about the supporting staff in the ER, which is the lab, the respiratory, x-rays, and when someone's in the emergency room, of course, they come in a crisis mode, and it's really important you get, whether it's an EKG and EEG, all those things have to be done.
When you enjoy being here, and you enjoy what you do and the people you do it with, it makes a huge difference.
That's true.
It really does. And having been a patient myself, you can tell that in the person taking care of you.
Whether they
you
like
know
what
if they're
doing.
there for a paycheck, or if they're there to make your life better, make their life better, and if they really enjoy. Yeah, and you can tell the difference.
Yeah, I think we have a pretty incredible culture.
Yes,
here
we do.
At KRMC.
We do.
They've done a really good job of hiring the right people.
Well, recruiting all over the nation makes a huge difference.
That's true, right? That's true.
You know, because when I worked at in Houston, I worked at a 1,500-bed hospital.
Oh my!
Yes, we did heart transplants, lung transplants.
Yeah.
You know, and I wanted to come back to something smaller. I wanted to get out of the city. And when I came out here for my interview, I was very, very impressed.
Great.
And I got such a great feeling. And I feel like I found a home.
Well, I think you did, and we're blessed to have you here
Thank you
too,
so
Tina.
much.
So thanks for being on the show. We've
Well,
learned
thank
a
you.
lot
It's my
again.
pleasure.
And when there's other new things, you'll have to let me know, and we'll have you back on.
Sounds incredible.
Okay. Well, I hope you guys enjoyed the program. We'll have another great guest on the show next week, so be back with us.